It's again our honor and pleasure to present Dr. Michel Komadja with this plaque. I'd like you to stay because we have some more things to do. You know, it's very rare that we have three presidents of the European Society. Dr. Komadja, can you join the panel, and Dr. Pinto as well? It's very rare that we have three presidents of the European Society of Cardiology with us today, and since we have a few more minutes, I decided to take the time and have an open discussion, and I'd like the participation of the audience as well. We were sitting together with the three presidents for breakfast and discussed some mutual relationship and question about what do we expect from each other. But definitely, I think it's good after the talk, wonderful talk of Dr. Michel Komadja, to raise the question of the European Society of Cardiology, which has 55 different nations, a lot of heterogeneity as we have seen. And here we have a country, Israel, and maybe Dr. Panos, the president. How do you see the role of Israel? What's the play of Israel in the European Society of Cardiology? What do you expect from the countries? And vice versa.
Mr. President, thank you very much for your comment and question. The role of Israel. European Society of Cardiology, as you said, has 55 member countries, national societies countries. As you know, European Society of Cardiology is a federal organization, and progressively, during the last 20 years, at least during the last 20 years, we are doing progress, and we have managed to run successfully a number of initiatives, look in the future also. In this, if we attempt to organize different groups of countries, I mean the 55 members, of course we can recognize countries with very large size, like France and Germany. Another group of countries with very advanced scientific level, not such huge countries, but very advanced scientific level, and other groups. Israel, like Switzerland, like Portugal, Greece, Belgium, belong to this group with advanced level, economic level, scientific level, very active persons. And of course, if you see our initiatives, these initiatives need the support of active persons. Here is the main issue, voluntarism. I have the feeling that the cardiovascular community of Israel is, one, active, second, innovative, and three, not saturated, not tired. My feeling is that here the atmosphere is different than some other countries where the doctors are more tired, more saturated. So this is a very good opportunity for the European Society of Cardiology to enroll first quality top volunteers to support the ESC initiatives. And there is a lot of work and a lot of very nice opportunities. And of course, again, we have to see and to discuss with the young cardiologists, the cardiologists of tomorrow. I was thinking before that probably it's important for countries like Israel, of medium size, to organize an event for the young cardiologists. 100 persons are the young cardiologists, the trainees. Why not? To gather them one day to discuss with them, because we have to invest in the future. So, to make the whole story short, I wish European Society of Cardiology to have many countries of such scientific level, so active and energetic, and I think we have to enroll, as I said, much more persons working for the European Society of Cardiology projects.
We have microphones in the room, so if you want to ask questions, please raise your hand and we'll have someone going to you with a microphone because we'd like to have some active participation of the audience. I'm sure there are questions, and it's very rare to have people. I can see someone there. Please. Yeah.
I want to say, Dan Sivon speaking.
Sorry, but
Danny, we can't hear you.
Can you hear me now?
Yes, I can see, yes. Yeah.
I want to say that in order to achieve high level of or providing high level of cardiovascular medicine, we don't need sophisticated lab tests. We have to do simple things. We have to do prevention. We have to do prevention of obesity. We have to take care of hypertension, diabetes, and cholesterol level. I believe that if we take, and physical activity, if we do all these things that actually need very little sophistication, but organization, you just need organization, then we can reduce the burden of cardiovascular disease in Israel and in Europe. So I think the key issue is prevention. It's not new techniques. It's something very old. And I think that we are concentrating too much on sophisticated method, on advanced implantation of valves, technique in the cath lab, and the way to improve cardiovascular outcome in Israel and in every country in Europe is by prevention of simple diseases that were mentioned several times during this meeting. Again, obesity, diabetes, hypertension, smoking, physical activity, all these things that actually require only organization in order to overcome this burden.
So, Danny, what would you change from what is today?
Well,
as you see, everyone is in agreement with you, but then how would you proceed? What would you change? What would you suggest?
Well, I think that, you know that I tried to organize a special group for prevention, and for some reasons this didn't, at the end of fruition it was stopped. And I think that in every country there should be a very strong group like prevention of oncological or cancer diseases. I think it is much more important to prevent cardiovascular, and I think that we have to have a group of people dedicated to this group, and I think that the Israel Heart Society should lead. The Israel Heart Society should be the leader, not to let the diabetologist, the neurologist, or the hypertension people. I think it's we who have to lead this field, and other people should join us rather than we join other people.
Dr. Pinto, should the European society take the working force and have something special for prevention, lead the global prevention?
It's actually an excellent point. Well, first, I couldn't agree more with you. And actually, if we look at the data, we spend, and this is OCDE data, 97% of the budget goes to treatment and 3% to prevention, which shows the dimension of the inequality of resources put into prevention. This is one thing. The second thing, we actually just came from Rome, where there was the meeting, the EuroPrevent meeting, where many things, which is the meeting organized by the Prevention Association of the ESC, where many things were discussed, but one very important decision, and it was actually, I would say, an historical moment, it was created a global cardiovascular alliance which will involve ESC and its national societies together with some world associations like KAJ and so on, and World Heart Federation and so on. And the goal here is to provide at 5 different levels, from education to training and so on, at different national levels to improve the penetration of prevention and basically make the cause for prevention. So there are many ways we can do that, and certainly the ESC, and that's the other comment I wanted to make, is united we stand. You know, the power that the ESC, all of us, you know, all of us belong to a certain country, although today the countries are getting more and more communication among themselves. We are more interested in some sub-area, but at the end, we are all ESC, and the ESC is a big platform where each one of us as a national society, as one of the sub-specialty groups, can actually use to get more power, more strength more force towards who have to make the decision, which are the policymakers at each country. And Europe, now with the opening of our Brussels office, we can actually have more, let's say, be closer to the power decision makers, at least at the European level, which can influence the rest of the world, actually. So I think there's a lot to do where a society like the ESC at the more global level as a big platform, together with societies like the Israel Heart Society, can develop programs that can be used. And here, well, there are so many things that we can discuss, but one important thing is we have to think about health professionals and not only about cardiologists. We are all cardiologists, of course, but we have to involve the different health professionals. Actually, Michelle just showed some data where the use, for instance, of nurses or other allied professionals can actually improve the way we can reach and we can have some results, active results, objective results in, for instance, treating hypertension or having a better control of diabetes and so on. So I think there's a lot to do here, and the societies, I would say, have a major role for advocacy, for lobbying, and making things a little bit more possible in terms also of education, training, and so on. So I couldn't agree more with you.
Yes, please.
Just one comment, Professor Lutan.
Yeah.
One comment here.
Sorry.
To this important issue. Nobody doubts that cardiovascular diseases to a significant degree are preventable diseases. And nobody doubts that we have to make our best for prevention. And there is huge space, as Professor Pinto says and you said, Professor Pinto said and you said, there is huge space there for work. Nobody doubts. However, because we are in Israel, because the innovation and innovative ideas and innovation is so rich here, I have the temptation to say only one word more. Dear colleagues, cardiovascular diseases are following the social patterns and some social concepts. 50 years ago, 80 years ago, was not the ischemic heart disease, was the rheumatic fever disease and valvular heart disease because the poverty, because the rheumatic fever, the famine. Nowadays, we are talking about ischemic heart disease and prevention, of course, diabetes mellitus, hypertension, etc. I agree, of course. But if I had to talk with a trainee today, I should talk for the cardiovascular medicine of 40 years from now, 30 years from now. And in 30 years from now, the nowadays trainees will be at my age in 30 years from now. So in 30 years from now, in many countries, even earlier, in many countries, we have to examine the next phase of cardiovascular diseases. And the next phase of cardiovascular diseases is degenerative diseases. The aortic stenosis in somebody with 90 years old is degenerative diseases. So please take into account that we have to see with vision the next perspective. And for sure, the cardiovascular diseases are going to be different in 30 years from now, and the nowadays young cardiologists should be prepared to work in areas like tissue engineering, okay, valves, etc., everything related to degenerative diseases in the cardiovascular system.
Well, thank you very much. Definitely, we have to think about being the present, but think about the future.
Okay, my name is Avi Roth, and I would like to address especially to the last distinguished speaker that noticed monitoring, telemonitoring, as one of the tools that we have to do with it in the future. Now, we all know that with escalating costs of medicine, with the shortage of physicians, with the population getting older and sicker, once people used to die healthy, today they live sick. So where is the place, or what do you do in the European community in order to provide telemedicine that can reach every person in every place in any time? And the communication today is flourishing, so it's not only monitoring, it can also be used for teaching, education, prevention, follow-up, and even treatment and triage.
We have to acknowledge first that the development of telemonitoring varies from one country to the other. Secondly, my point was to say that since we are facing a huge number of patients with chronic diseases, in some instances you can replace direct face-to-face visits by telemonitoring with a nurse or central collection of biological or, let's say, blood pressure data in order to avoid such an overwork for professionals. I don't say that telemedicine will replace traditional medicine, but it can be helping in the fact that we are overwhelmed with cause of chronic patients that in the future we will not be able anymore to deal with. This is one way. The other way, as mentioned during my talk and by my colleagues in their comments, is to ally with nurses or GPs in a better way than we are doing at the moment, because when you look at what happens in ESC countries, I think it is fair to say that the collaboration between different kinds of professionals is at best variable across different countries, and this should improve together probably of the involvement of pharmacists in some regular checkup of patients with hypertension, heart failure, or whatever. So I think we have to rethink entirely the networks of professionals who are taking care of chronic disease. Acute disease is a different setting. But I would like to come back to the point made by the first intervention. I slightly disagree with the fact that prevention only without education will succeed, because I gave you good examples of failures which are recent failures. And I think that in particular we have to face the fact that the junior generation is fascinated by novel technologies, TAVI, electrophysiology and so on, and they are not very much concerned by prevention, which is more humble but which pays off much more. And I think that the key word in this matter, and education here is very important, is to prioritize the objectives of healthcare in cardiovascular disease.
Thank you. Since we are very late in time, we have a minute for a question and a minute for an answer. Avi, you're standing. Quick.
Okay. Avi Shotan, I have a short question or suggestion, and not very expensive. Following the education, especially the young generation, many of them don't have the budget to come to the large meeting in Europe. I think you should organize, not only in Israel, like highlights of the ESC or the prevention, heart failure, etc., and to bring to the various countries for short meetings the expert. And to following education, those of you who listened yesterday to Eugene Braunwald, there was not much innovation, but it was very important for the young generation. And the last remark, I think, like startups, if there is a new idea, a new meeting, a new initiative in education, I think the ESC should consider to support, not financially, but to give the umbrella of supporting meeting like cardio-oncology, cardiac pregnancy, etc. With the support of the ESC, it can, as one who tried it, it's easier to do it and to distribute the idea.
Dear President, response?
European Society of Cardiology has recognized many of these realities indeed. And the European Society of Cardiology is working very actively at the moment. It's pity because we have not time to present the basket of our activities. The European Society of Cardiology is working so actively at the moment to catch the next generation in the next years, take into account the cost, the effectiveness, etc. For example, we have the working group e-cardiology, and we are working very hard in this area. Of course, we have to persuade the governments to reimburse e-cardiology. Telemonitoring, somebody before talked about telemonitoring, it's very important. These congresses and conferences, small congresses, of course, European Society of Cardiology at the moment, for example, has available for you all the material. I think it's free of charge for the members, free of charge, all the material of the annual Congress. The 365 project offers the opportunity to our members to go there and to see everything, slides, videos, presentations. To make the whole story short, if somebody likes not to go to a Congress, brackets, the Congresses are serving also social reasons. It's very important to have the opportunity to speak with somebody else from another country, etc. But if you like to enjoy all the Congress of Munich, as it was presented last year, during the winter time, in your home, it's perfect, it's easy, it's now available, for example. This is only an example.
I want to meet the people.
Sorry?
I want the young generation to meet the people, not the computer.